A very good evening. It gives me immense pleasure to invite you on the 47th episode of our Gyan Pravah. Gyan Pravah, the flow of knowledge. And as you can see on the screen, powerhouse of positivity and perseverance, two ladies, forever young and forever inspiring in front of me as we celebrate the International Women's Month. I think it goes without saying a strong backbone gives a path already a stronger support for all of us. I welcome Dr. Anjana Pandey Gupta and our Fogsi vibrant president, Dr. Sunita Tandulwadkar ma'am. Dr. Anjana, we all know her. You have heard so many things about her from me as well, but she is indeed an inspiring figure in the field of stem cell research, which is the new thing which is upcoming, and Madam is doing lots and lots of things about it. Here I am referring to a woman who stands out for her unique contributions and leadership in transformative area of the science. Dr. Sunita Tandulwadkar, our Fogsi president, is an exceptional breaking barriers and making a significant mark and impact in the scientific community. There are so many things in her kitty to say. I mean, what not? You name the field and she's everywhere. Just if you listen to her speaking on the stage, it gives a serenity, the tranquility with the knowledge and the power which she speaks out. And that's something very, very inspiring. An awestruck, inspired person like me and all the other committee chairpersons, Dr. Anjana, I would like to tell you this is the first time in the history of Fogsi that we are given this platform and a proper recognition where we are able to, she has given us free hand to select the celebrities and talk to people about the daily things what are happening around us. Her positivity, her perseverance and dedication in making a difference in medicine and patient care. She is an epitome of strength. I mean, not only the field of stem cell therapy, infertility, laparoscopy. I mean, when I was very young, since then I'm listening to this forever young female in front of me and what not, accolades and accolades. I am truly like inspirational, somebody who, just as I said, you smile and say, and it starts in our blood and we start doing everything, I mean, the way she wants. And you won't believe it is just February end. She took the charge in January and 2 months, I mean, barely 2 months, I would say. And we have seen so much of focused arena, a lady with difference. And she has not only involved people in promoting the ethical practices, as well as giving them the new dimensions, creating leaders on her own. So I'm talking about not her professional, but on a different aspect of what she is doing. Madam, you and Anjana share a common word, Arogya. She is sitting at Arogya Lakshmi and Madam has got Arogya Yatra. You won't believe she has finished 2 yatras, Tirupati and Rishikesh. And the amount of traveling, the amount of impact and spirituality she carries. We started with her Guruji's blessing at Gagangiri Maharajji, and I know we were far away, but the vibrations do reach us, and she has only advanced the science in her specialty, but also has been a beacon of hope for many individuals who are seeking solutions to difficult medical challenges like PCOS. Right now, Madam is focusing on that and you will see something good coming up and I'm very sure about it. I'm also waiting for the things to happen for me. So, Madam, thank you for inspiring and being with us in all the odds and outs situation. And I would welcome Madam to say a few words of wisdom over here.
Thank you, Archana. Too generous use of words. Dear, you made me feel very, very awkward. I don't know whether I deserve all that, but what I know is I work with tremendous honesty and 24/7 I think about this organization since the day I got elected 10th August 2023. I'm working, designing the project because it's a 1 year. And in 1 year, you have to do so much for the woman health, for the maternal health, and also for your organizing team, your managing team, your Foxians, academic knowledge, giving them the due respect what they deserve. And that is why Har Ghar Foxian is my Nara for everyone, because every Foxian work 24/7 for their patients in their hospitals. And I feel they deserve to be recognized, they deserve to be applauded, and they deserve to be respected. And that is what I'm spreading to the society, that you have no choice than loving and respecting your gynecologist, whoever is you treating you across the country. This podcast is also one way of giving something different to the gynecologist apart from academics. Let everyone come together and learn something from someone. And no one can just do in a panel discussion of 10 beautiful faculty and one question, 1 minute answer. No one can absorb, or no one can elevate their soul or thinking or their knowledge beyond certain capacity. And that is why this Gyan Pravah podcast is there. And I'm very sure in 30 to 45 minutes of a dialogue, which my committee chairperson, they study the person, they study the subject, they design the questions so that the podcast should become one of the best podcasts. I'm not saying only podcasts they are doing physical CMEs, they are managing so many projects, publications, they are involved in presidential, all academic and non-academic, social, all activities. So I'm thankful to all my 30 committee chairperson, and today, Anjana ji, having you is such a great pleasure.
Thank you so much. Thank you so much.
I'm sure this podcast will be one of the most memorable podcasts. Archana will always have it. Thank you so much for being there. And Archana, thank you for working hard for this Gyan Pravah podcast, which is only one link to join. You don't have to search everyday link for yourself. One link anytime. And they're there on the YouTube channel. So if you could not make any day, just keep on reading them or hearing them whenever you have time. Thank you so much.
Thank you.
Thank you, ma'am, for the kind words and the encouragement, as you always flow with that with us. And it gives me another proud privilege to introduce Dr. Anjana Pandey Gupta, who is a senior, highly respected rheumatologist known for her expertise in diagnosing and treating various autoimmune diseases, musculoskeletal disorder, and inflammatory conditions in city of Agra. She has so many degrees to her accolades, but a few of them that she's practicing at Arogya Lakshmi Health Center, Agra, and she was a professor of medicine and in charge rheumatology clinic, PG Department of Medicine, SN Medical College, Agra, for 13 years. She is the first one to start the radiology and rheumatology services in Agra. She has memberships and fellowships of various national and scientific and academic bodies. Research interests are specifically in the field of osteoarthritis, crystal arthropathies, and soft tissue rheumatism. Guided and co-guided approximately 42 theses, she has approximately more than 50 national and international papers in her credit. She has various chapters in distinguished books like API Textbook of Medicine, Scientific Updates, API and Scientific Updates, IACM. She was the youngest professor also, and I have seen her groom and do so many conferences in her organizing skills. So it's a great pleasure to have you, Dr. Anjana, with us. And erstwhile rheumatology clinic and arthritis and autoimmune clinic, a unit of Arogya Lakshmi Healthcare Center, Agra. She's practicing, and let me tell you, madam has also practicing as a solo clinic in Pune, and she's giving health solution to so many people without saying and without even declaring that she is helping so many people in her own way and in her own style. So having two strengths in front of me gives me immense pleasure to take on from here. And we'll be discussing, madam, regarding osteoarthritis, musculoskeletal diseases in the females, especially during midlife, which is troubling them. Some people do come up with their solutions to the doctors, and some people silently suffer. So here, as I said, I identify madam and you because going to the Arogya Yoga Yatra gives you a first fitness in the musculoskeletal system without which you cannot walk. The places where you need to worship, because God always stays, you need to have some tapasya in form of physical and spiritual to reach them. So I think we are justified to talk about the musculoskeletal diseases today when we think of Arogya Yoga Yatra as well. So
Thank you, Anjana ji.
Thank you, Sunita ma'am. Thank you, Dr. Archana, for giving me this opportunity. And I'm really honored to be a part of Gyan Pravah. Thank you so much for that.
Thank you. Thank you. And Anjana ji, I'll be in Agra. I'm coming for a UP Con in Agra. And if
Great.
possible, I'll definitely meet you.
Definitely, ma'am. You're most welcome. You're most welcome. I'll be your host, ma'am.
Thank you. And as the protocol is, you and Archana will have a dialogue, and I will listen to you all from different link.
Sure, ma'am. Thank you.
Thank you, ma'am. Thank you. So, Dr. Anjana, we are here to discuss about rheumatology and musculoskeletal disorders. So, my first question to you is, when did your interest in bone health begin? Because you did MD medicine, and after that you wanted to pursue as a rheumatologist.
Yeah. Actually, if I go back to my undergraduate days, I think one of the most underrated subspecialty of medicine was rheumatology. And basically, it was confined to short notes on either rheumatoid arthritis or systemic lupus erythematosus. And whether it was lectures, whether it was clinics, the more emphasis was always given to subjects like cardiovascular system or neurology or abdomen, but nobody taught us rheumatology. So if I share a very some of the questions that were given during our undergraduate days, the most common short notes were on rheumatoid, write down the deformities that you see in rheumatoid arthritis. So somehow it was ingrained in our mind that rheumatoid arthritis is one disease that will always lead to deformities. But that was wrong, because if you diagnose rheumatoid arthritis, treat it at a very early stage, then you can prevent all kinds of deformities and patient can live absolutely normal life. But the basic problem was that nobody taught us rheumatology during our undergraduate days. So when I sat in my OPD as a postgraduate student in medicine, I was really shocked to see the huge number of patients that were coming with joint and bone diseases, and especially the females. And that probably incited me to know more about this subject. So I decided to pursue this field.
Perfect. That's the insight you had and you pursued it. So if I say, what is arthritis? For a layman, arthritis ho gaya hai. So is it one disease, or it's a blanket terminology for multiple disease which is going underlying a female or a male, I would say?
See, it's not a blanket terminology. We have almost 100 kinds of arthritis, and each arthritis differs from each other. And what happens basically, if we say arthritis, it is basically inflammation in the joint or in the surrounding structure. And what is inflammation? Inflammation is presence of pain, redness, swelling, or sometimes a loss of function because of that pain of that joint. But what happens when we say term arthritis, instantly what comes in our mind is joints only. But arthritis is more than that. Arthritis is one condition which can involve almost any part of your body. And if you're not able to diagnose it at the right time, it can lead to disabilities. It can lead to deformities, and it can also lead to organ failures. So always remember, arthritis or joint manifestation in arthritis is just a tip of iceberg. So whenever you deal a case with joint pains, you have to sit with your patient. You have to spend some time so that you can properly take the history and do the clinical examination of the patient, so that you can rightly diagnose what kind of arthritis your patient has.
So do you feel there's a gender bias when we talk about arthritis, females preponderance more or the male preponderance more? Or maybe we just see in the midlife the female is complaining more. Is that the scenario?
Absolutely, yes. I think since ages, arthritis is in grossly love with female gender. That is very true, and multiple reasons are there for that. It can be genetic, it can be hormonal imbalances. It is the skeletal framework of the females which is less as compared to the male counterpart. So definitely, arthritis is in love with female gender.
So I think being a female, if I ask what is bone, and is the bone disease more commonly affecting the females in their midlife?
Yeah, certainly, yes. And we basically, midlife is one thing, I think it's the milestone, which is very difficult for any female to accept. Because midlife is one stage in female's life that brings lots and lots of apprehension, anxiety. And apart from that, I would say what is basically happening, your protective hormones, that is your estrogen, is releasing you from its cocoon and warning you now you just take care of yourself all alone. That is the basic what we can understand about midlife. And midlife is one stage in which a female has to be prepared to accept many challenges in life, because not only externally your hair is graying, you're getting wrinkles, your internal appearance is also changing. So we have many diseases or bone diseases that can be seen during midlife. But the most common ones are, first is low bone mass, that is known as osteopenia or osteoporosis. You can have degenerative arthritis, which is known as osteoarthritis. And apart from that, there's another condition which is known as sarcopenia. Sarcopenia primarily is not a bone disease. It is basically decrease in muscle mass, but it can secondarily result into bone diseases.
So I think sarcopenia is something which is a silent epidemic and catching up very much in the society. And people forget to think about the muscle mass. They are only thinking about the bone is the culprit why the joints are becoming more and more painful.
Yes, very true.
So is the pain always associated with such diseases?
No, if I say if I talk about osteopenia and osteoporosis, it all depends upon whether you are having osteopenia, osteoporosis, or you are having osteoarthritis. So if we talk about osteopenia and osteoporosis, that is the disease with low bone mass. They are basically silent diseases. They never cause pain unless you develop fracture. So if you have low bone mass, you tend to develop fracture as a result of very trivial trauma. Like if somebody pushes you or pulls you, or if you fall from standing height, then fractures might happen. So once you develop fracture, then pain is there. Otherwise, it's a non-painful situation.
So do you think there's a link that sarcopenia can cause osteoporosis, osteopenia, or vice versa?
See, I have already told you that sarcopenia is not direct. It's not going to directly affect your bones. Sarcopenia is a condition in which the muscle size shrinks. So when the muscle size shrinks, it gets weaker, and there will be tendency to fall. And basically, if you have a low bone mass and you fell down, fractures will happen. So if you are regularly exercising, you have a strong bone, then falls will not happen. So even you have osteopenia or osteoporosis and falls are not happening, then you will not develop fracture.
So that is very important take-home message, that whenever we are into the midlife, just walking is not enough. So you need to train your muscles by weight-bearing exercises. You can practice yoga, you can practice meditation, you can practice walking, but I think weight-bearing exercises gives more strength to the muscles, henceforth preventing the falls. That fall prevention is one thing which is very important. So directly or indirectly, you are helping to balance yourself and creating less injury to your body and better health. So being a basic gynecologist, Dr. Anjana, I would like to ask you that we are very fond of giving menopause hormone therapy. So do you think there is any role at a certain time, or maybe, your perspective as a rheumatologist in that?
See, I'm not an expert for that, but definitely if you are you are in a phase of perimenopause or menopause, then probably MHT is I think should be a recommended therapy to keep your estrogen levels up. But ideally, when you are planning to prescribe hormonal therapy to any patient, then definitely it should be started under expert guidance, because you need to check for the risk factors that the patient is having. Otherwise, it can be catastrophic also.
So earlier the better, and in a proper hands is a better solution if you want to prescribe MHT, because it should be tailor-made and it should be individualized as per the patient's requirement. One shoe doesn't fit all. That is the basically decorum which we have to maintain when we have to prescribe the MHT. Food fads are in vogue. keeping bone health strong. So these food fads, what do you say about that? Eating this, eating that, not eating this, not eating that.
Yeah, it's in fashion right now, basically.
Yeah.
People are opting for fancier food rather than going for seasonal and local. So I always recommend seasonal and local. So it all depends what kind of food you require, depends upon your underlying bone condition. So if you have low bone mass, then definitely you have several options around you which are very readily available and economically viable also. And among them, my favorite is dairy products. You can go for anything which doesn't contain sugar, basically. So dairy products have got a very good bioavailability. And the second food, which is very easily available, I think very cheap also, that is green leafy vegetables. It has got all the ingredients that is required for the bones. It has got phosphorus, potassium, calcium, everything. Even it has got iron also, very rich in iron. So majority of the females in India, they're anemic also. So if you consume green leafy vegetables, your bones as well as your blood levels will be on a higher side. And apart from that, adequate amount of calcium D supplementation is required, and vitamin D is also required. And one thing which I would like to emphasize upon calcium is that basically what happens, we have many preparations in calcium which are giving you a very high dose of calcium in single tablet also. But one thing that should be remembered is that your kidneys can tolerate or handle only 600 milligrams of calcium at a time. So it is always advisable to take calcium in a divided doses rather than taking it in a one go. That is very important. And as far as vitamin D is concerned, so you have like a very freely available source for vitamin D, that is natural sunshine. So it is recommended that you should sit in sunshine for at least 15 minutes, exposing your face, upper arms, that will suffice. And the timing should be either before 10 a.m. in the morning or after 2 p.m. because in between that period of time, the sun rays can be dangerous for you. So vitamin D is another thing that is required. And one should quit smoking, alcohol intake should be minimized. So apart from that, anything which is local, seasonal, that will always help you.
That goes without saying that vocal for local is the new
exactly.
thing, and we should support that very much. So many midlife patients who complain the joint pain, especially knee, back and shoulder pain, they have got difficulty in climbing the stairs or getting down, squatting. Once they squat, Indian toilet system basically, then they have a difficulty in standing up from there. Is it only low bone mass or any difference of opinion, and how should we guide these patients?
Basically, if some patient is coming in midlife and patient is complaining you that she or he has difficulty in climbing stairs, getting up from squatting position. So one thing that should click in your mind is that his or her knee joint might be weak. And why is it weak? It is because of degeneration phenomena or a wear and tear phenomena that is going in your body, and it affects your cartilage. And what is cartilage? Cartilage is a protective cushion that is between your knee joint bones. And once this cartilage is gone, the friction occurs between the bones and it leads to inflammation. That is swelling, pain, redness, and loss of function of that joint. And if it is not treated or handled properly, it can lead to complete architectural disruption of the joint, and patient can land into severe deformities.
So that is very important, that you should be well supported. I think fall prevention, there should be railings after certain time, except that it's not a failure, it is just a change in the body. So have railings, have support whenever you walk. And I think proper supplementation with calcium and vitamin, and a very valid point, as you said, it should be taken in divided doses. Some patients are very difficult because they say, I'm eating healthy, so I don't need calcium supplementation. So I think here we would advocate strongly that you need to take supplements along with the food and the dairy products and the green leafy vegetables, as Dr. Anjana has already pointed out. So a little word about, like, if I talk about that a patient is suffering from osteoporosis and another patient is suffering from osteoarthritis. So what is the difference? I mean, how do you go about it? Like if the patient has to be guided when she's osteoporotic and osteoarthritic patient.
See, in midlife patients, they can occur simultaneously also because degeneration is going on everywhere in your body. But just to differentiate osteopenia and osteoporosis, they are silent diseases. Unless fractures have occurred, it doesn't cause pain. But if we talk about osteoarthritis, it is a painful condition. And how to diagnose, I've already told you that if you have pain during climbing stairs, if you're getting up from squatting position, if you sit at one place for a long period of time and you try to walk, you won't be able to walk for a few steps, and after that you will be fine. And this phenomena is known as gelling. So if it is happening, this is something very characteristic that you might be having degenerative arthritis or osteoarthritis.
So how much importance do you give to the exercise regime, and what should be the exercise prescription to our patients? I mean,
maximum. I am addicted to exercises. So that is my favorite prescription to every patient of mine. And I think the physical activity is one thing that should be maximum and to attain the peak bone mass. And ideally, it should be started in the early 20s. And the best exercise to increase your bone mass, if you are starting it very early, you don't have any kind of joint problems, then that is high impact exercises. So it can be anything. It can be jogging, it can be running, it can be hopping, it can be Zumba or anything. So, but always remember that if you are recently diagnosed with this osteopenia and osteoporosis, you are in your midlife and you have aching joints, then don't go for impact exercises because it's going to be bad for your joints. You can choose for other alternatives for exercises. We have certain low impact exercises also. You can go for resistance training. You can go for even something what happens if the patient is not able to walk also. You have a very bad joints. Then we have chair yoga also. There's ancient Chinese practice which is known as Tai Chi. It is very much similar to our yoga practices. That can be performed also. Balancing exercises are very important. I think this is one of the very important part that is missed while we are exercising. And even walking, simple walking is a very good balancing exercises. But always remember one thing, when you are in a habit of exercising, then you should not repeat same kind of exercise throughout the week. I mean, it's not recommended. You should shuffle between the exercises.
So I think cheating your body, sometimes doing yoga, sometimes pranayama.
Yeah, even 5 times if you're doing in a way, that is sufficient. But 2 times you must go for muscle training. That is very important to prevent sarcopenia.
Sarcopenia. And sarcopenic obesity is also a term which is coming out. So I think along with exercise, you should check your lipid, like especially LDL levels. If I say you should keep it below 60, it will not do justice to the Indian food, but at least below 100 should what we should be targeting. So are you routinely testing every patient? What type of blood test do you recommend when the patient comes to your OPD? I mean,
see, ideally, we don't have any blood test as such. Like it all depends upon if somebody is coming with osteopenia or osteoporosis. Like if the patient has risk factors for osteopenia or osteoporosis, like the person has family history of recurrent fractures. If you look at your grandparents, if they have huge hump on their back, so that indicates you might be carrying gene for this osteopenia or osteoporosis. So in those patients where the risk factors are present, that can be your age, more than 65 in female, more than 70 in males. If you are on certain drugs that can lead to osteopenia and osteoporosis, and the most common one is corticosteroids. And secondly, now I think every second or third patient is taking ecosprin also. So if you are on anticoagulants, you are on anti-seizure medicines, corticosteroids, they are again risk factor for developing osteopenia or osteoporosis. And in my patients, many patients, they come with autoimmune inflammatory arthritis, which is known as rheumatoid arthritis or systemic lupus erythematosus. These patients also have tendency to develop osteopenia and osteoporosis. So if I see risk factors in my patient, I go for a test which is known as dual energy X-ray absorption, or in short, we call it DXA, DEXA test. So DEXA is one test which is a very beautiful test on which we assess the T-score of the patient. So if T-score is very low, that means the patient can be having osteopenia or osteoporosis. But if the T-scores are very low and patient has fracture also, then it is known as severe osteoporosis. Similarly, if the patient is coming with degenerative or osteoarthritis, generally no test is required because it is a clinical diagnosis, but sometimes the inflammation is very high, so we might check for this acute phase reactants, that is ESR or CRP. Sometimes we go for X-ray to assess the grade of osteoarthritis that patient is having. And definitely you should check for calcium and vitamin D levels also. If they are on a lower side, you must supplement that.
Great. So once you identify the risk factors and you are also advising them MHT, and I think when you come to the actual therapy, medical therapy, so what would you recommend to your patients? Because lady who's in 35, 45 range, it's very hard for them to accept that I'm already suffering from osteoarthritis. They have painful joints, there are daily chores they have to take care of. So they need to be relieved of the pain first of all. And what should be the follow-up medication? I mean, how do you help them out?
See, when my patient is having osteoarthritis, so I sit with my patient, I spend sometimes more than 30 minutes with them, counseling the importance of exercises, because that is one thing which is cornerstone for managing osteoarthritis. But for that, patient should be pain-free first. So as far as drugs or pharmacotherapy is concerned, then acetaminophen is our favorite molecule because it doesn't have much side effects. But sometimes what happens, the patient has got very much inflamed joint, then probably you might have to take help of non-steroidal anti-inflammatories or tramadol also. And apart from that, certain preparations are available like glucosamine, we have chondroitin, glycerin, many supplements are available which states that they're going to boost up your like cartilage, which is in a degenerative phase in the joint. And we have other options like we have intra-articular injection we can give corticosteroids, we can give PRP, and stem cell therapy is right in vogue. So still we don't have any robust data that can support the use of stem cell therapy in osteoarthritis. So that is, I would say, preparations are available, but still in pipeline. So we are relying more upon the non-pharmacological therapy in form of hot and cold fermentation. Topical ointments can be given to the patient for pain, acetaminophen or non-steroidal anti-inflammatory. And once your patient is free from pain or pain has been reduced, then you ask your patient to go for graded exercise program. And some like precautions are also required in which we ask the patient to not to overuse the joints basically. So we ask the patient to avoid squatting, climbing stairs, sitting cross-legged. We ask patient to avoid all these postures.
So they do have restriction of certain movements to get them more better joint stability because it's a progressive kind of a disease probably. Yeah. So how much importance, like once you, as you rightly said, that the symptoms should be addressed, but history taking is very, very important. Yes. So do you feel that there is a role of comorbidities like diabetes, especially thyroid patients? Like you're dealing too much with the autoimmune patients also. Like if I have a pregnant lady who was already having SLE, dealing with autoimmune disorders, so does she have more chances of getting predisposed to the arthritis? So she needs to be addressed more properly at an early stage.
See, patients should not get pregnant without proper counseling. That is very important. Otherwise, they might lose the baby also sometimes because we have certain antibodies which are not very good for the fetal health. So in case if the patient is already diagnosed with systemic lupus erythematosus or any kind of autoimmune inflammatory disease, you must, as a gynecologist, you must send your patient to your physician or rheumatologist for the proper counseling of the patient because it is in ideal scenario, the disease should be quiescent. I'm talking about SLE or rheumatoid arthritis. The disease should be quiescent for at least 6 to 12 months before conception. If it is not there, then there are higher chances that we might lose the baby.
Yeah, so preventing unwanted pregnancy, I mean, the patient ladies desiring the pregnancy, that should be always be addressed. So that is the role of preconception counseling. So whenever the patient comes to us, I think Dr. Anjana is giving us a very good insight. Do take the history, whether there is some joint problem or the other things also, and always dig out. Talk to that patient. Actually, all rightly said, 30 minutes is not fair enough. We should give time to listen to their complaints. So that would help us diagnose many problems. Obviously, the blood test, everything is there to support us, but giving time and taking a proper history is a very, very important milestone when you are dealing with your patients. Because we cannot afford to lose the baby at this stage where people are designing their life in a very luxurious way. They are planning the pregnancy, and maybe the couple plans 1 or 2 pregnancies, so that should be uneventful. So rightly said, the question period is very, very important, as you said, before we actually ask them to plan their pregnancy. HCQS is a drug which I have heard about, and many of us are into the prescription when we talk about SLE and pregnancy. So continuing that in pregnancy, and what should be regular follow-up with the rheumatologist like you if the patient is already established case of SLE and she's pregnant after the proper counseling. So how should she go about, because joints are already giving problem and pregnancy itself is going to add on to the problems to her.
You read my mind basically. I was thinking about HCQ only because even you haven't asked this question. I'm going to share this like my opinions on HCQ on this forum, because I've seen many of the gynecologists, they are apprehensive in using HCQ during pregnancy because of the congenital defects and all. But HCQ is one drug which is very safe, very safe. And especially in rheumatoid patients and SLE patients, it should never be stopped. Even in APS also, antiphospholipid antibody syndrome, it should never be stopped because it is one of the agents which can protect the fetal heart also. So HCQ should be continued throughout the pregnancy. It should never be stopped.
So I think postpartum, that is the area where we now are coming with the concept of 4th trimester, Dr. Anjana, where the lady has already delivered in the 6 weeks postpartum. So when she is more prone to have like these rheumatoid diseases may worsen because of her lack of exercise. I mean, the family socio-economic status, when she's jammed into a room and said, don't work, just lie down, feed your baby. So any message for these females, because these are the candidates where heart, joints, bone, muscle, everything is very fragile. So what do you want to convey to them at this forum?
Yeah. See, one thing which is very beautiful about autoimmune disease is that it becomes silent during pregnancy. But immediately after delivery, what happens when you have this feeding phase? So there's one hormone which is known as prolactin is released, and prolactin itself is a pro-inflammatory hormone. And when it is released, then there is sudden surge in cytokines leading to flare of arthritis in the female. So my recommendation is that you should never sit idle, even after delivery also. It all depends upon whether you have gone through vaginal delivery or cesarean section. Some restrictions are there. You cannot perform those exercises which are related to that part because that part is still in a healing phase. But rest, all parts can be mobilized, range of motion exercises can be started. Pranayama is one thing which ideally should be avoided. It should not be done when you have undergone the cesarean section because total thrust occurs on the abdominal muscles. And ideally, I think it should be avoided for 6 weeks or so unless your gynecologist recommends you to do that. But apart from that, mobilization is very important immediately after delivery. And every female should practice exercises as per her capabilities. And it should be started under proper guidance only. Don't watch WhatsApp or YouTube channel and start with the exercises. You must ask your gynecologist first, obstetrician or physician first, that what kind of exercises are going to suit you. You can start with them accordingly.
So I think rightly said, Dr. Anjana, that once we see somebody teaching the Surya Namaskar, we immediately jump and start doing that.
Yes.
Actual is the process where you need to strengthen your muscles, weight bearing, Start slowly, go slowly, and once you have established good musculoskeletal coordination with your body, I think it's a mind, body, and soul game where you have to understand that your body is not same as the other person who's running or jogging on the field, and you're not at par with somebody. You
Yes.
have to know your limitations and practice the exercise according to your smart goals. Rather than setting the goals of somebody else's who's going to
Yes.
influence you, you should have your own goals, small but reachable, attainable. And I think being reinforced off and on is very important.
See, it's a sustainable, I mean, everything that you're going to perform should be sustainable. That is very important. Because what happens, exercises are a phenomena which require consistent effort. And if you put your heart and soul in your exercises, definitely you will feel pleasure out of that. And once you feel pleasure out of that, basically what happens when you are exercising with your heart and soul, endorphins are released. And endorphin is one thing which elevates your mood, and it's a very natural pain reliever also.
So that's a very important point. So exercise for relieve your pain as well. Be happy. I think if you soak yourself in a proper diet and a proper channelized daily workout, that would be nothing like it. And I mean, you won't need anybody else to help you out. That is a very important take-home message, Dr. Anjana. And as you very well said, that relieving the pain is very important whenever we are taking care of our patients. So any OPD experience or anything in common, like you see so variety of patients. So immediate post-pregnant status and in a menopausal status, how do you feel that the patient with the same complaint? So what difference do you feel with these patients or the lighter note, and the counseling is same, the advice is same, or little bit of a difference?
See, when the patient comes in a post-pregnant phase, she's always very happy because she's carrying a cute little angel in her lap. So that scenario is entirely different. And when you see a post-menopausal female, she's quite frustrated because the kids are growing up, they are going away, they are not listening to you. You are no more, but they're not dependent on you, basically. Husband is
Priority.
Priority your
changes.
hormones are playing with you, basically. That is why I have said the protective hormone is leaving you now. Now you have to take care of yourself. So when you see a post-menopausal patient, the counseling is more important, I think, because she is suffering from lots and lots of problems, which I think nobody understands, because when she talks to her mama or like grandma, she says, I have suffered the same thing. That is quite normal. But it's not normal for a female to have aches and pains, leaking urine. This is not normal. I mean, it should be addressed. And this is the duty of a doctor, that you should. I am a great proponent of not running a heavy OPDs, basically, because you need to give time to your patient, because when I am right now in a perimenopausal phase, I can understand what is going inside now. So I can understand my patients in a better way, as it used to be when I was blowing with hormones, I would say. So I think time is very important. You must listen to the patient. Empathy is very important. Patient is not requiring your sympathy. Empathy is one thing which is very important for every patient, and especially when it comes to post-menopausal or perimenopausal female. I'm a great proponent of that.
So rightly said, I think the practice nowadays, you don't need a psychiatrist all the time sitting by your side to counsel your patient. You need to be the in charge, the solo in charge of her faith in you. Simultaneously, you have to also see that there's a OPD waiting. So you have to be welcoming, have to be very, targeted questions so that she comes out very nicely with her problems. And you have to give her a planned approach. I think Dr. Anjana will agree with me that every patient needs a planned approach, because sometimes you may start the medicine, then sometimes you need the exercise, sometimes you need them to come for the follow-up, and sometimes you need to be reinforcing them quite often.
Yeah.
So when you have to...
That is one part which is very important.
Very important.
Every time please.
Yeah, please. Go ahead.
So whenever like I am day in, day out dealing with joint pain patients. So every time when my patient comes to me, even I have a physiotherapist around, but I always ask patient to perform one exercise in front of me. So just to know whether she or he is doing that or not.
That is very important. To be like a monitoring kind of a thing is very, very important, and that should go very well seep into the patient's mind as well. That I am counseling, I'm giving you treatment for your disease. That doesn't stand true for the same patient, other patient who's waiting. The complaint may be same, the joint pain, but the categorization of treatment, the planning of treatment may be different. So I think you rightly said that it comes with giving time and empathy to the patient. That's very, very important. So if you're giving so much importance to your profession, Dr. Anjana, I would like to ask you how, just on a lighter note, how do you balance the perimenopause, your OPD, and how do you, what is the guidance would you like to give to the doctors like us, that how to remain smiling, healthy as a bone and joint specialist?
Go
I mean, you
and
have to be fit and fine
yeah.
all the time.
See, I always believe in the fact that the woman who stays stronger always stays young and beautiful. And I think every women should go and hit the gym, make your muscles stronger. Why should boys have all the fun? That is my fund of life, and I enjoy that. I have already told you that exercise is kind of addiction for me and for my husband also. So I never miss upon the exercises. I daily go to gym. I perform yoga. I do swimming, all kind of exercises that I can do. Daily I'm doing that. And I have like restricted my work also, because I always wanted to give quality work, not quantity work. So I see lesser number of patients. I try to satisfy, though it's not possible for me to satisfy all the patients, but I try my level best to satisfy each and every patient of mine. And after that, because rheumatology is one field which never has emergency like gynae and obs. In that way, I'm blessed because I don't have to attend night emergencies. So I have time for me after 6 or 7. So after 6 and 7 till 6 a.m. in the morning, this is my time, my family time. I enjoy it then.
Thank you for being so humble. I know the OPD's appointments of yours are always full, but doing justice is very, very important when you're sitting at the chair where the patient is coming with lots of pain. And empathy is something which you gave us as a take-home message, which I think we all will carry forward to that. Towards the fag end of our talk, I would like, what message do you want to give as a consultant rheumatologist, or maybe a fraternity doctor female, to an adolescent patient, to a reproductive age patient, and to a midlife patient? How the advice would vary, a take-home message to each age category.
See, if I talk about the adolescent patient, I would see my advice is always try to be as active as possible. That is, I think, if you start very early during adolescent phase, then probably you might not land into any kind of diseases in future. So for adolescents also, like it's a responsibility of the parents that they should not be overindulgent with gadgets. And for that, you need to take out time from your busy schedule and take them when they see you exercising or doing something for you, which makes you happy, they are going to follow you. So you are the one who can teach them. So if you want your adolescents to be active, happy, away from gadgets, then definitely you have to follow the same norms. As far as reproductive female is concerned, so my opinion is going to be same again. See, if you don't have any illnesses, you are like, even if you, like majority of the females, they say that I am performing household tasks and doing exercises. And basically they say that they are deriving exercises out of those household work. But that is not true. See, if you are doing dusting at your home, who is at mental peace while doing dusting? So exercise is one thing which you should enjoy. Nobody enjoys dusting. So if you enjoy that, definitely if you are deriving pleasure out of cooking, out of dusting, out of cleaning your home, then definitely it's going to be exercise for you. But if you're not deriving pleasure out of that, then go out, take out some time for yourself, You can do anything. You can do walking. You can ask your friends to come at your place. You can dance with them. It is again kind of good exercise for you. But when you come to that phase of 35 or 40 years, then this is the time when you should be alert, because this is the time when you are going to catch majority of disease because of the hormonal play. So this is the time when you should be very vigilant about your health, your diet, and everything. But you should not go very maniacal about your diet. Basically, what happens, see, my funda is that whatever your nani or dadi or your grand mothers were cooking, that was perfect for you. So don't change that norm, because your intestine is adapted to that. So continue with that kind of a food only. Don't try to change your food habits. That is going to harm you only if you're going to change them. So for perimenopausal female and menopausal females, it is very important, if you haven't exercised previously, now this is the high time that you should take care of yourself.
So thank you, Dr. Anjana. It was fruitful to talk to you, knowing about the musculoskeletal health, especially when we talk about osteopenia, osteoporosis, and osteoarthritis. So being pain-free, being scheduled, being reinforced, and taking yourself to a heights where the me time becomes a daily practice for you is very, very important. As Dr. Anjana already said, if you enjoy something, it's going to give you pleasure. That pleasure always shines in your daily course, and daily exercise is a must, along with the dietary modifications, which is going to be a long run therapy for any disease. And by and large, all the comorbid conditions which are associated, gut related, diabetes related, I think everything is related with the joints, the muscle strength. So what you eat is very, very important, and how do you digest is also very, very important. So proper, small, divided, frequent meals with a small portion of all the tongue tickling foods would give you the desire of satiety and keep your stomach little more fit on the grounds, because you have to create a balance between everything. That is what is our theme, that creating balance between your gut, mind, body and soul, and keeping yourself fit, young and forever is a new rule, new mantra, because there's an entity known as emptiness syndrome. People are going to be with you, your kids, everybody, for a certain time. Then you are left and out of the cocoon, so you have to shine up like a butterfly. And that starts with the me time, where you exercise, you reinforce, and you're not panicking about what other person is able to do and you're not able to do. Any age is not less, because I believe myself that age is just a number. So wherever you start, the life kicks on from there. So thank you, Dr. Anjana Gupta ma'am, for sharing the insights with us. And I'm very thankful to our vibrant and very active president, Dr. Sunita Tandulwadkar ma'am, who's herself a role model for all of us, traveling. Everything, whatever she is doing is we should be imbibing the success, but the success should be based on hard work. The concrete slate today will be your future tomorrow. Don't forget to reinforce. That is what I have learned by today's talk. And keep yourself moving. In motion is something which is the new fad, new thing in now. You can skip your Insta, Twitter and Facebook, and you can skip all the electronic gadgets. Take hold, take command of your body for today and forever, and you'll see the difference. As Dr. Anjana is leading a very hectic life, she was very humble to say that I'm seeing less patient, but what we know of, the OPD is flooded, the appointments are booked well in advance. To take her this time, also Sunday, we had to plan it very nicely. So thank you, Dr. Anjana Gupta, for being with us. It was a very fruitful discussion. Some other time in some other platform, we will see you again. Thank you, team. Thank you, everybody. Good night and have a smiling week ahead.
Bye.